Hi guys, today I'm going to be talking to you guys about typhoid fever, which is a bacterial infection that is caused by a pathogen with the name of Salmonella typhimurium, but for short we're going to be calling it Salmonella typhi for the rest of this video. And as you guys can see on my slides, wherever they're going to be out on the screen, I have a picture of the pathogen itself and also a picture of the disease, which you can see in the picture. It shows red spots in the lower stomach area, which is a symptom that we're going to be discussing later on in the video when we get to symptoms. Now moving on to slide 2, Salmonella typhi is transmitted through fecal oral, basically meaning feces being consumed by a person's mouth, which is very gross, but that is how you obtain typhoid fever. It's very gross, but that's how you get it. Contaminated, this pathogen would enter the body through contaminated food and or water. So anyone handling your food or your beverages at all, water, to be more specific, water, if they didn't wash their hands properly, and they, like after using the restroom, if they didn't wash their hands properly, you can potentially get typhoid fever and be infected with this bacterial infection. Typhoid fever, its only host is the human body. That's all it needs to take over, just the human body. Moving on to slide 3, the pathogen enters the body through the gastrointestinal tract, and it takes over the intestinal lining, and from there it then spreads to the bloodstream, the liver, spleen, and gallbladder, just invading that whole area. This infection goes through about 4 stages, and these stages essentially being by weeks. So in week 1, a person would experience a fever, a stepwise fever, which basically means the fever is gradually getting worse, and the fever would be between the temperatures of 102 through 104 degrees Fahrenheit. In week 2, the infected person would experience some of the symptoms that we're going to be covering a little later, such as diarrhea and abdominal pain. Those are 2 symptoms that any infected person would most likely see within those 2 weeks. Week 3, the infected person will start to experience more severe symptoms, such as a swollen liver and spleen, dehydration, just things like that. So in that stage, the infection becomes more fatal to the infected person. And by week 4, the person would be in pretty bad shape, to where they would most likely be in the hospital fighting for their life, because this is a very fatal infection. Now moving on to slide 4, the pathogen Salmonella typhi plays a trick on the body. Salmonella typhi, it replicates the white blood cells in our body, and once the pathogen replicates the white blood cell, it moves through the bloodstream how a normal white blood cell normally would in the body. So yeah. Now moving on to slide 5, which is the symptoms that I said I was going to mention earlier. The symptoms for people, it ranges between many things, and those things being stepwise fever, as I mentioned already, slow heart rate, a rash, abdominal pain, diarrhea, bleeding of the intestinal tract, sepsis, swollen liver and spleen, myocarditis, and rose-colored spots. The reason that these symptoms have this great of an effect on the body is because when the immune system is introduced to bacteria, the bacteria causes the immune system to become unwell, essentially. Basically, everything in that area becomes unwell, is the best way I could put that. As I mentioned previously, typhoid fever is a very fatal infection. So, without treatment, without any type of treatment, the survival rate would be a 1%, which is very, very bad. But with treatment, the survival rate would be between 30 to 40% for those who are infected. Now, moving on to slide 6, I'm going to be telling you guys about a story. Well, I'm going to be telling you guys about the most popular and famous story about this disease, about typhoid fever. This story is about a woman named Mary Milan, but most famously known as Typhoid Mary. Mary was a Irish cook, so she served people. She was a cook, and somehow she got this disease, typhoid fever, and since she was a cook, she was unknowingly infecting a lot of people, and researchers say that she infected about 122 people during her time as a cook. But out of those 122 people, 3 of those people have confirmed to have died after being infected with this fever that they have contracted from Typhoid Mary. When people started to find out that Typhoid Mary had a deadly disease, a very fatal disease, she was quarantined, but she didn't want to be quarantined, so she tried to get out of the quarantine and go back to being a cook. But she was then caught, and she was quarantined for a second time by police officers. And during her quarantine was very long. It was 30 years. During that 30-year quarantine, Mary sadly died from typhoid fever. And that's just the story of Typhoid Mary, also known as Mary Milan, her real name. Moving on to slide number 7. This is a little background about currently, like what typhoid fever has become and what it used to be and what has become now, what we know about it, what we knew about it then and what we know about it now. When typhoid fever first started going around, people were very unsure of what it was. People thought it was many other diseases that it really wasn't. And also at this time, I would say about the 18th century, people weren't, how should I put this? People weren't very fond or too focused on cleanliness, or bacteria, of how to prevent or cure bacteria at the time. So people didn't really pay that much attention to bacteria and, just normal cleanliness that we have today. But back then, people completely ignored it. But later on down the line, like the late 18th century, Salmonella typhi was actually discovered. That's when it was confirmed a thing. And it was confirmed a thing. They confirmed it as it being spread through contaminated food or water. And as I mentioned previously, if you don't clean your hands properly, you can possibly get typhoid fever. After using the restroom, you don't clean your hands properly, you can possibly get typhoid fever. Yeah. Now moving on to slide 8. This bacterial infection can actually be treated, and it can be treated with antibiotics and also a polysaccharide vaccine. That's how you can treat this. If you go to the hospital, you're going to be treated with most likely antibiotics. That's the most common thing it is treated with. But to prevent this whole infection overall, to prevent typhoid fever and contracting this pathogen, I want to just say, as I said multiple times, washing your hands thoroughly, cleaning your hands, and also getting the vaccine. Just getting the vaccine overall would help you not obtain this infection, and thoroughly washing your hands. Moving on to slide 9. I'm going to be telling you guys about our current status on this pathogen and this overall disease, typhoid fever. Most people in the U.S., because people in the U.S. do get this infection, but most people who do get it have reported to have been traveling internationally to places such as Africa, Asia, and South Asia, India, and Latin America, where this disease is most common to be found. Out of our global population, 9 to 21 million people globally contract typhoid fever. The percent of people who get typhoid fever in the U.S. is very low, but the percent increases when people travel internationally without having things such as a vaccine or safety protocols and hygiene protocols and cleanliness protocols. And lastly, moving on to slide number 10, some interesting facts that I learned about today's disease discussed, which was typhoid fever. I learned that, 3 interesting facts that I learned is that some people who get typhoid fever show zero signs of sickness, so they can essentially be affecting people unknowingly. They don't know they have it themselves, and they don't know that they are infecting other people. That's number 1. Number 2, I also learned that getting the vaccine for typhoid fever is not permanent. It's not lifelong. It's not permanent at all. It's going to prevent you, but it's not permanent at all. Number 3, this infection is mostly waterborne, so mostly transmitted through contaminated water, as I mentioned previously. Also, waterborne, a waterborne bacterial disease. And a myth that I learned is that the most common myth about typhoid fever is that it is the same as typhus, which it is not. Typhus is a completely different disease that we're not going to get into because that's not what we're here for. We're here for typhoid fever, not typhus. But that concludes everything that I wanted to talk about today